And now we have Dr. Esther Park-Hwang, who is a gynecologist at the Multicare OBGYN Associates in Tacoma.
Good evening, colleagues. I actually am one of the faculty at the Tacoma Family Medicine residency program. And so when Stuart asked me to do this talk, I actually tested my presentation on them. They thought it was kind of fun. So it's probably going to be more interactive and kind of, you keep scores. So although we don't have a prize at the end, you'll be your own judge of how well you're informed. So goals and objectives for this presentation would be to define what a vegetarian diet is, to discuss the type of vegetarian diets, review some of the weight gain recommendations during pregnancy, nutritional requirements during pregnancy, vegetarian sources of nutrition, and what the health impact of a vegetarian diet is during pregnancy, and how well do you know your vegetarian ingredients, and have fun learning and share what you learned today with your colleagues and your patients. So let's go to the definition. Definition of a vegetarian diet is a diet consisting of fruits, vegetables, beans, grains, seeds, and nuts. These are the type of vegetarian diets that people currently practice. They're called the flexitarian diet, which are mostly vegetarian. So probably 1 or 2 meals a week, non-vegetarian. A vegan diet excludes all meat and animal products. Lacto-vegetarian diet includes dairy products as well as vegetables and fruits. And lacto-ovo-vegetarian includes both dairy and egg products. So this is a typical vegan food pyramid where you got the whole grains down on very basic bottom part of the pyramid, fruits and vegetables on the second tier, calcium-rich foods, all vegetarian sources. In the third tier, protein-rich foods and fatty foods and things that you shouldn't eat too much of. All right. So if you look at the Vegetarian Times, vegetarianism in America is a study published by Vegetarian Times showed that 3.2% of the U.S. adults, or 7.3 million people, followed a vegetarian-based diet. Now, they're not strictly vegetarian, but mostly vegetarian. Approximately 0.5%, or 1 million, are vegans who consume no animal products, and about 10% of the U.S. adults consider themselves mostly vegetarian. So if you look at the world map, the United States actually is pretty good. Goes into the 10 to 13 percentile range. The highest country that practices the vegetarian diet is right there. Right here. Does anyone know which country that is? All right, 33% vegetarian. Okay, so these are the weight gain recommendations, and it's based on BMI. And we all know what BMI is, right? I don't need to explain that. Okay, so here's your normal BMI. This is the general recommended, is 25 to 35 pounds. If you're over 30 BMI, you're considered obese, and the recommendation is to gain about 10 to 20 pounds. A large study in Belgium actually looked at weight loss during pregnancy of approximately 700 women, and weight loss of up to about 5% during pregnancy improved outcomes. The calorie composition that's generally recommended during pregnancy is 25% protein, 25% fat, and 50% carbohydrates. This is based on a University of San Francisco study. All right, so when we look at nutrition during pregnancy, we look at macronutrients, which are the carbohydrates, the proteins, the fats and fiber and water, which we need in larger quantities, and the micronutrients, which are the rest of the things, like trace minerals and vitamins. Okay, so just take a look at the micronutrient list, and it includes all of your calcium, iron, magnesium, and some of the things are increased during pregnancy in terms of need, and some aren't. And this is actually 1-a-day women's prenatal vitamin. And I want you to take a look very carefully at vitamin D, vitamin B12, iron, 28 milligrams, iodine, zinc, 15. Omega-3 fatty acids are currently recommended for newer development of the fetus. And if you can remember the numbers, we'll see how good your memory is. This is a typical vitamin. So calcium is 1,000 milligrams a day that's recommended. Do any of you remember how much calcium was in a typical prenatal vitamin? Okay, calcium is right here. How much? 200. And how much do pregnant women need? 1,000. So if someone tells you, I'm taking my prenatal vitamins every day, is that enough? The answer is no. So you actually have to eat. I almost like to think that calcium is actually a macronutrient because you need so much of it during pregnancy. But these are the food groups that you can find calcium. And a lot of people tell me, but doctor, I drink 3 glasses of milk a day. Do they get enough calcium? Do they get a net calcium gain or a loss? It's a net loss because of the biochemistry. How about essential fatty acids? Do you remember how much omega-3? So this is alpha-linoleic acid. You can find it in flax seeds, oil, canola oil, walnuts, soybeans, and then here's the list of omega-6. If you trust my word, the prenatal vitamin did not have enough of that. Folic acid is something that a lot of generalists and people who don't actually specifically take care of pregnant women also advocate is at least 400 micrograms prior to pregnancy, but when they actually get pregnant, the recommendation is 600 micrograms. So this is actually enough in the prenatal vitamin, but these are your sources of folic acid. And protein increases from 46 grams per day to 71 grams. And when you say, you need to eat more protein, they say, okay, I'll eat more chicken. So you can actually get a lot of protein in whole beans, whole grains, soy products, vegetable nuts, and seeds. And here's another one. B12 is something that we don't generally see in natural vegetarian products, but fortified cereals, meat substitutes, fortified non-dairy milk, nutritional yeast, and supplements can take you to 2.6 micrograms per day. And zinc, do you remember how much zinc was in that prenatal vitamin? 15. So zinc is sufficient. How about iron? So daily was 18, and now you need 27. How much iron was in the prenatal vitamin? All right, so just shy. And these are the ingredients with iron. And then vitamin D. Do you remember how much vitamin D was in that prenatal vitamin? 400. And they actually need 600. So this is an ongoing debate among the literature of how much vitamin D does the pregnant woman actually need, or any individual. And currently the studies are showing that approximately 1 to 2,000 international units are what's recommended to maintain if you have an adequate level. If you're deficient or insufficient, then the rate goes up. So well-designed vegetarian diets that include fortified foods or supplements meet current nutritional recommendations and are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, and adolescence. This was published in the Journal of Academy of Nutrition and Diet. All right, so what particular benefits does a vegetarian diet have during pregnancy? So we all know that there's about a 65% rate of obesity among pregnant women. And if I compare to, if I've been in practice for 20 years, if I had to count the number of bariatric patients that I took care of 20 years ago, it would be maybe less than 20 or 30. Now it seems like every third patient I see has a BMI of 50 to 70. And I'm sure our cardiologists and internal medicine colleagues are seeing that. But this is the reality, is that our population is getting more overweight. And by the time all our medical students are in practice, the rate will probably be increased. So what kind of complications do obese pregnant women have? Well, they are at higher risk for having hypertension, including superimposed preeclampsia. They're at higher risk of having gestational diabetes and higher risk of having surgical complications from morbid obesity, increased risk of preterm labor, increased risk of intrauterine growth restriction, and increased risk of surgical morbidity. So there was an interesting study that looked at excessive weight gain during pregnancy in vegetarian women, and they actually had a decreased risk of excessive gestational weight by 54%. So we had a patient who came from California who started out at 400 pounds, and by the time she was delivering, she was 525 pounds. So she had gained 125 pounds during her pregnancy, and she came to Washington because no one in California wanted to take care of her. This is another study that was done a while ago in the 1980s, looked at a population, it's a retrospective chart review, looked at a population of vegan pregnant women, and the incidence of preeclampsia in that population was 0.1%. Okay, the other condition we talked about is obesity, and of course when we talk about gestational diabetes, we can't leave out the neonatal hyperglycemia that babies go to the NICU for, and extreme shoulder dystocia, which can be a permanent neurologic problem for these babies. Okay, so this is the fun part that my residents told me, because some of them actually scored less than I told them they needed to call Stuart. But as we go through these slides, if you can guess 25 or more, you are undefeated. If you can guess 20 correctly, you are an excellent nutritionist. And 15 to 19 is considered good. 10 to 14 is fair. 5 to 9, there's opportunity for improvement. And if you guess only 1 to 4, really need to talk to Stuart. All right, so we're going to quickly go through this, and I'm not going to grade you guys. It's you could be your own grade. So as we go through, just check in your mind. Do I know this? If it's yes, then you get a point. There's a slide with multiple veggies. If you can get more than 5, you get 5 points. So let's go. Okay. Okay, good. You can shout it out because we either know it or we don't, right? Great. So some of you are probably from Southern California, right? Because they have these all around Southern California. Avocados. There's a red variety and a white variety. Quinoa, that's right. Great. Edamames? Okay, name 5. Okay, Swiss chard, spinach, kale, bok choy. Great, broccoli, collards. Bok choy. So a lot of my residents from the Midwest had never seen this vegetable. It's like, you gotta know this before you go back home. Okay, any guess? All of these ingredients were listed in the nutritional guideline that I presented before. That's right, blackstrap molasses for iron. Okay, name 5 beans. That's great. So 5 points for that. Okay. This is another one that a lot of my residents didn't know. It's like, what is that? It's a fig. How about this? Sunflower seeds. Yeah, I try to trick them. They got this one. How about this? Yeah, this is the... yeah, it's... flax for your omega-3. This one's a little hard, so I added the flour and the seed and the oil. Not coriander, but does start with a C. Canola oil, that's right. It's canola oil. What are these? This is a giveaway, the leaves. It's not a fruit. Walnut. Yep, it's the walnut. So this is a polycarp around the walnut. You take that off, you get the shell, you let it sit for 4 weeks, and then you crack the shell open and the meat is inside. These are walnuts. How about these? Almonds. It's wheat, it's red, it's whole grain. That's right, it's nutritional yeast. The only source of small amounts of vitamin B12. Sprouts. Yes, these are meat substitutes. Great. Okay, so overall benefit of a vegetarian diet: decreases risk of obesity, heart disease, diabetes, high blood pressure, cancers, colon, endometrial, ovarian, and breast, and I'm sure Dr. Swenson will tell us more, and elevated cholesterol. And these include conditions in the pregnant women. So take-home points is that vegetarian diet during pregnancy is safe for both the pregnant woman and her developing fetus. A well-balanced vegetarian diet supplies all of the macro and micronutrients required by the pregnant mother and fetus, and improved health outcomes with risk of decreased risk of surgery, as well as for the baby, with a balanced vegetarian diet. And the best thing is that you can actually make that happen.